and welcome to the Multicultural Media Online Conference hosted by the Ministry of Health, Multicultural Health Communication Service, with the support of Multicultural New South Wales. I'm Jesusa Helaratne, Deputy Director of the Multicultural Health Communication Service, and on behalf of the team, the Ministry of Health and MHCS, we are so glad that you joined us again today. And today we have our special guest. I'm so pleased to have and to introduce him. Today we have Dr. Jeremy McAnulty, who's back with us. Dr. Jeremy, thank you for joining us.
Thanks for having me.
He's Executive Director of the Health Protection New South Wales. And also we have returning as a guest, Dr. Philip Britton, Staff Specialist and Head Department of Infectious Diseases and Microbiology of the Children's Hospital at Westmead. Dr. Phil, how are you?
Good, and great to be with you.
I have our own Dr. Phil here in New South Wales Health. So thank you for joining us. And today we have a special topic that we're discussing today. It's respiratory syncytial virus, or RSV. And the RSV virus is currently high in the community. So that's why we're focusing on this topic today. But before we start, we'd like to begin by acknowledging the traditional owners of the land from which we are all meeting from today. We pay respects to elders past, present, and emerging, and pay respects to our Aboriginal colleagues and community members who are joining us in this session. And we also pay respects to multicultural communities and religious leaders who are also joining this session today. And Dr. Jeremy and I are joining from the land of the Camaragal people of the Eora Nation. So we have just some reminders. Please keep your microphones on mute, and please tap away on the chat and to chat room and ask your questions and give us your opinions. And it's really great that Dr. Phil and Dr. Jeremy are here to answer all your questions about RSV. Now, RSV, as we said, is currently high in the community. So we wanted to share the latest information and resources with you and what it is, who is affected, and how communities can best protect themselves. Now, Dr. Jeremy, what is RSV?
So RSV is respiratory syncytial virus. So it's a very common virus that circulates in the community at certain times of the year. It is particularly difficult for people who are very young, who haven't been exposed to it before and therefore have no immunity, small babies, or the elderly who can get some disease, serious disease. But any of us can be affected by it and tend to have milder symptoms if you're not in those categories.
So it's more children or adults? Is there a variation?
Yeah, so as I said, anyone can be infected, and we probably all get exposed to it regularly because it's so common. But small babies, the younger you are, under 5, the younger you are, the more likely you are to have more severe disease. If you're elderly, you can get outbreaks in aged care facilities, for example, and elderly people can sometimes be hospitalised from it. But most of the hospitalisations we see are in young children, particularly under 1.
And the number of RSV infections in the community has been increasing. Can you tell us a bit more about what we're seeing?
Yeah, so pre-pandemic, so up until about 2020, we would see, a bit like clockwork, cases of RSV outbreaks occurring before the flu season. So in autumn, early winter, we'd see a big surge in cases, particularly in children, of RSV infections. And we'd see that in children presenting to hospital with respiratory problems and a condition called bronchiolitis, which is a inflammation or infection of the part of the tubes that go into the lung. During the pandemic, with the lockdowns around the world and low travel around the world, we saw very few cases of RSV. But when we opened up again and travel started again, RSV came back in large numbers, and it wasn't quite in the same season anymore. So we saw large numbers out of season. And so this year, we're still seeing a disruption to that normal pattern with lots of cases now, a bit earlier than we would expect pre-pandemic, at high levels. And we're still seeing an increase in cases.
Thank you, Dr. Jeremy. Turning now to you, Dr. Phil. How do people know if they have RSV? What are the symptoms should people be watching out for, especially for parents?
Yeah, good question. Look, For most people who get RSV, it's going to be an upper respiratory tract infection. So it's going to be associated with symptoms like runny nose, sneezing, cough, sore throat, fever. But in certain populations, as Dr. Jeremy has said, it can affect the lower respiratory tract, the lungs themselves. And the people who are particularly prone to that are very young children and older adults, as we've said. And in little babies, where it goes to the chest and causes this infection called bronchiolitis or sometimes pneumonia, what we see is difficulty breathing, heavy breathing, often quite irritable and difficulty with feeding. And so when they develop poor feeding, those children can become dehydrated. So that's the little babies. In older adults, where it goes to the chest, they will report shortness of breath, difficulty breathing, chest tightness. And as well as those two groups are people with pre-existing lung disease, particularly asthma, where RSV is a very good trigger of asthma attacks in people who already have asthma. In terms of the symptoms we see, usually those kind of upper respiratory symptoms, runny nose, cough, fever, they start a couple of days after infection. And then the lower respiratory tract symptoms, the difficulty breathing, heavy breathing, usually proceed from there day 3, 4, 5.
So it's like a worse version of a flu. Could that be how you would compare it to?
I guess a lot of the viruses, and Phil can chime in here, a lot of viruses that cause upper respiratory infections, they're hard to distinguish just clinically or by the symptoms. But this tends to affect, RSV tends to cause this bronchiolitis as one of the kind of hallmark conditions that causes hospitalizations in small children, as well as pneumonia, as Dr. Phil said.
How could it be spread, Dr. Phil? RSV, how could one get it? And if with the young children, how could it spread?
So this is a virus that's spread by what we call respiratory droplets mainly. So when people cough or sneeze, those droplets immediately go into the air surrounding that person, and other people can pick it up if it impacts somebody's nose or throat or eyes. The other way in which it's passed between people is actually on their hands. So when somebody coughs or sneezes onto a surface, this is a virus that people can pick up on their hands on that surface when they rub their eyes or nose. That's where you can get transmission. Now,
easy to get it, isn't it?
Yeah, that's right. Now, unlike some other infections, that most of the infectiousness occurs when people have symptoms. So it's not an infection that tends to be transmitted by people who don't have any symptoms. It's when people have those runny nose, cough type symptoms that they're passing it to other people, either through droplets or onto surfaces, and the other people pick it up on their hands.
So who are the people who can get, likely really sick with RSV? And you said the children, but and older adults, you said that it could get really serious.
Yeah. So in children, it really is restricted mainly to children under 12 months of age in terms of severe illness. So that bronchiolitis, pneumonia requiring hospitalization. So that's the key age group is the under ones. However, if children have other medical problems like heart or lung diseases, and of which there's many, that group of children can get more unwell even if they're a bit older. Okay, so focusing really on the under ones, under twos with other medical problems. In older adults, it's really people over the age of 65. And in particular, as Dr. Jeremy said, it's older adults with other medical conditions or weakened immune systems. And particularly, we do worry about older adults in aged care facilities where these outbreaks can occur.
Yeah. If you have any questions, please put them on the chat. We have Dr. Phil and Dr. Jeremy to answer your questions. Dr. Jeremy, how do people know if they have RSV? How, they maybe have a runny nose? Should they get concerned immediately that they might have RSV?
So most people, there's lots of different viruses circulating in the community, and most of us cope with them and get over them unless we happen to be at the extremes of age or have underlying conditions. And so most people don't need to be tested for what they have, unless you're getting particularly sick or you're worried, but in which case you should consult your doctor. In that case, particularly those people who go to hospital, such as the small babies with those conditions we talked about before, the doctors will take a test. And that test will look for a variety of causes of the infection, such as flu and COVID and RSV and parainfluenza. And that test, which is usually a PCR test, will show whether or not it's RSV or not. Most people don't need to have a test if they're otherwise well, but those people for whom knowing what the infection is and therefore what treatment might be needed, it's important that they are tested and seek medical attention. So if you're particularly vulnerable, because you're a small baby or an elderly person or have underlying disease, then having a test. And in fact, for reasons of COVID planning and flu planning, we say if you're vulnerable to severe disease because you're in those groups, make sure you have a pre-existing plan with your doctor for what you should do if you do get symptoms of a respiratory disease.
And how do you make that plan? When you go to your doctor, just discuss it with them? Discuss
with your doctor, say, check to see if you are at a particular vulnerable group for whom treatment might be recommended. I'm not talking about small children now, I'm talking about people generally. But people with underlying medical conditions. Talking to the doctor can say, well, I think that if you were to get symptoms, we'd need to know what the virus was, and therefore whether you may require antiviral treatments depending on what the virus is. So having a plan ahead of time makes things happen much more quickly.
And that's great, Dr. Jeremy. And I think, Dr. Phil, that would be basically the advice by GPs as well. Would that be something that we should be seeking out advice from our doctors as well, especially is this something that we should be recommending?
So yeah, what Dr. Jeremy's emphasizing here is if you've got a child or an adult who's got existing medical conditions, discussing with your doctor ahead of time what you would do if you had a respiratory infection, that's a great idea. In terms of people who don't have other medical conditions, having that pre-plan may not be necessary. It's more about what red flags should you look out for that you might be becoming more unwell. Because most people with RSV, as Dr. Jeremy said, they're going to get an upper respiratory tract infection, a cold, and they're going to be able to manage that in the usual way. Stay at home while you're sick so you don't pass it to somebody else. Use things like paracetamol or ibuprofen and make sure that you keep your fluids up. That's pretty standard advice. But if you're a parent of a young child, or if you're an older person, what you need to do is be very sensitive to whether you're getting those lower respiratory tract symptoms. So in young babies, look out for how they're feeding, making sure they're able to keep up with their fluid intake, and watch their breathing. Most parents will have a pretty good instinct about what their child's breathing is normally like. And if they're seeing heavy breathing in their child, that's the child who needs to go and see a doctor, particularly those younger children under 1.
Thank you, Dr. Phil. Dr. Jeremy, how can we, as a community, make sure that we're spreading the messages correctly, and how can we keep our community safe?
Spread the message, not the disease. That's right.
Yeah.
So I think those basic public health measures that we've learned over the last few years, such as Dr. Phil said, if you've got symptoms, stay at home. If you need to go out while you've got symptoms, use a mask. Avoid visiting high-risk people who are vulnerable should they get infected, particularly important. So the elderly, small children, people with underlying conditions. Avoid going to aged care or hospitals as visitors. Because outbreaks can readily occur in those settings, and we want to avoid that altogether. And good hygiene is very important.
And we have learned most of this, and sometimes we do forget it. And I think maybe it's important. I learned that it is important to have a pack in the bag, if anything, tissue and make sure that you have you're able to just the general remembering those messages that we had before. When you're unwell, stay home. And the good thing now is we're able to work from home and stay home. Unlike before when you take a sick leave, but here when you're feeling just a bit down, then you can work from home. Dr. Phil, what is the best way to manage RSV?
Yeah, good. So in young children, if they develop the symptoms that could be RSV, the key is to really monitor them closely over those first few days of the infection, that they don't develop the heavy breathing, the signs of this bronchiolitis infection we've been talking about. If you do think your child has got heavy breathing with an infection that could be RSV, you really need to see a doctor. And in many cases, that can be your local doctor to assess the child and give feedback and advice, maybe do a test if that's useful. But if you think your child's breathing is very heavy or you're very worried, this is a condition in young children that requires you to go to hospital. And so you could do that in two ways. One, you could call Health Direct, which we know is, you know, an accessible health advice line to everybody, and you could get some immediate advice. But if you're very worried, take your child to hospital yourself. Or if you're uncertain, you're very worried and you don't know what to do next, you call 000, and that's where the ambulance can come. And children who get RSV involving the lower respiratory tract when they're young can become very unwell and require quite a lot of hospital care. So I don't want to underestimate that need. If you're worried as a parent with a young child with heavy breathing, you really should see a doctor and maybe sometimes even call an ambulance.
And as I say, if you do need language support and you needed to call Health Direct, you call 131-450 for the TIS National and then ask for Health Direct,
Yeah.
which is important. Are there any medications for RSV for infants? Could they have something stored at home for their children just in case, or just making sure that they're aware of what's available?
So really good question. And of course, we are talking about RSV today because there's quite a bit going on in the community, as Dr. Jeremy said. But the other reason we're talking about RSV today is because there's a new RSV prevention treatment that's become available. And New South Wales has a program that's just starting, particularly for vulnerable infants. So that preventative treatment is what's called a monoclonal antibody, and it's given to children before the RSV season, before they get RSV, to prevent them from becoming very well. So it's a bit like a vaccine. It certainly gives the child immunity, but it's not the same as a vaccine because it's not actively testing or training our immune system. Rather, it's what we call a passive immunization. We're giving antibodies via injection. And in New South Wales, as of this week, this is available particularly for vulnerable infants. There's information on the New South Wales Health website so that people can look up and really check whether you have patients or you have a child in your community or in your family network who could be eligible. But the highlights are that this is provided free of charge through New South Wales Health hospitals for children who are born prematurely, for children from an Aboriginal or Torres Strait Islander background, or for children particularly with congenital heart disease, so that's heart disease that they're born with, or lung disease that they're born with. All right, so the eligibility criteria are quite complex, so I do want to encourage people to look that up on the New South Wales Health website to get all of the details, but I've given you the highlights. And that's a completely new tool that's being used in New South Wales this year. If you think you could be eligible, or your child or a child that you know could be eligible, you should talk to your doctor about that as soon as possible to get it in now as RSV's circulating in the community. There is actually another one of these monoclonals that's been around for a number of years called palivizumab. The one I was just talking about is called nirsevimab. And that antibody is used through hospitals, but is not as widely available, nor is it as freely available as this new one that has come online in 2024. So look, I think that's very exciting from an infectious disease point of view. And we do encourage people to talk to their doctor about whether there might be a young infant or baby that they know or are looking after who could be eligible.
And the great thing is, this is fantastic information, Dr. Phil, because it's new, and I think it's also important for those to know that it's free. It's available in New South Wales.
And it's important at the moment. It's through public hospitals,
Yep.
and so that's where the vulnerable children are.
Yeah.
In the future, there are going to be new vaccines available for adults and pregnant women that will also assist in controlling and preventing disease.
Well, this is great information. So for those multicultural media online and also the health workers who are working with multicultural communities, this is great information to share with the community. And also, Dr. Jeremy, it's great to hear that those infants who are more likely to get sick from RSV can get medicine, just like Dr. Bill. But what about older people?
Yeah, so for many years there's been work on RSV vaccines. Dr. Phil mentioned that this is the newly available product is a monoclonal antibody, which is very similar to a vaccine, but it doesn't give you this active immunity. Vaccines for adults that do that are becoming available now. You can purchase on the private market. So there's a process in place nationally to look at how they might be funded and made available. But for people over 60, they're available, and you can talk to your GP about if they're right for you, if you're in one of those high-risk groups that Dr. Phil mentioned before.
Thank you, Dr. Jeremy. We have a question from Sonam. It's difficult to assess health of young children as they're not often, they don't cooperate. And he also said, not cooperative. Isn't it better for parents just to take their children to hospital than underestimate the condition and let the situation get worse? Dr. Phil.
Yeah, look, thanks very much. Really what I do is encourage parents to trust their instincts. Parents know what their child is like when they're well, and they have very good instincts about when their child is unwell. So if you or a parent you know is looking after a young child and they think that child has a respiratory condition and they're unwell, they should see a doctor. If they're worried that they're very unwell, they should go to hospital. I really do think parents' instincts are very good when it comes to this, and they should be encouraged to act on their instincts.
Thank you, Dr. Phil. We have a question from Eric. When can the newborn be vaccinated, and would it be safer to keep your newborn away from visitors until they can be vaccinated? I get that. I'll throw that to you, Dr. Phil, again.
Yeah, look, newborns can receive this new immunisation, this monoclonal antibody, if they're eligible. And I, again, encourage people to look at the eligibility criteria, which are available on the New South Wales Health website. With respect to can you protect your child, I think it's pretty reasonable if you've got a young baby to, when you're receiving visitors, and we all have visitors to visit babies, but when you're receiving them, it's quite a normal thing to say, just check that people don't have a current illness or a cold or anything like that. I think that's very sensible advice. Trying not to have unwell people visiting young babies or unwell people visiting aged care facilities, as Dr. Jeremy mentioned, is a really good practice, and we all need to take responsibility for not transmitting respiratory viruses between us, and particularly to vulnerable people.
Dr. Phil.
And it's probably good to point out too that if you're expecting a baby in your family or in your friendship group, make sure you are protected. So with you're up to date with your flu shots, your COVID shots, and if you've got symptoms, don't go and visit, of course.
Yes. And there's a lot of...
I should have mentioned the whooping cough shots, the DTPA vaccine, which is important too.
What about the doctors and medical professionals out there? What should we be advising them as well?
Well, yeah, look, all of us in the medical and health professions need to make sure we're up to date with our vaccines. And that's easy to do these days through the employees or your GP. So we all have to look after our own health, but also because, those of us working with patients are going to be continually exposed to infections in the community.
Dr. Phil, you're there in the middle of everything in the hospitals. What is your advice to the colleagues and also to families in ensuring that we know all about RSV, because it is quite new. We know flu, we know COVID, but when you say RSV, what's that? So what should we be doing?
Yeah, excellent. And I like to talk about the big three respiratory viruses: COVID, influenza, RSV. They're the big three. We should all know about them. The good news is all of them now have either vaccines or immunizations for different eligible cohorts. And so as doctors, we should be encouraging people to be aware of respiratory viruses, aware that they can cause severe disease, and be taking every opportunity to prevent them. Okay, and which includes vaccines and immunizations. In terms of the general community, I would be saying to them, you should be thinking about what can you do as a good community member to prevent transmission to vulnerable people. And if you are caring for or associated with vulnerable people, be they young children, people with other medical conditions, or older adults, think about talking to your doctor to access vaccines or immunizations if you're eligible as soon as possible before the respiratory viral season really kicks off.
And I think also for community leaders out there who are having events, making sure that they're advising people to follow advice of washing your hands or being careful. And I saw an invitation before that if you are unwell, please do not attend this event. And I think that's just being proactive, isn't it?
Yeah, no, we're all living in a big soup of humanity, and we all have germs that are around us. So I think everything we can do to kind of keep each other safe by, doing those simple things like staying home if you're sick, and good hygiene, and encouraging vaccination are all just important parts of, I guess we're lucky today in that while we still see nasty diseases like RSV and meningococcal disease, we don't see a lot of the diseases that have been essentially wiped out by vaccination, like diphtheria and polio, at least not in Australia, thanks to our high vaccination levels. So, but if we drop our guard and drop our vaccination rates, then these things can come back.
These things, yeah. Dr. Phil, there's Easter coming up, it's Ramadan, there's festivals happening in April. It's something that we should be really raising awareness to people, especially parents and also the vulnerable, as you said.
Yes, look, absolutely. I want to be the first person to say that these community festivals, these religious celebrations, of course, are incredibly important to communities. And we don't want to discourage people from participating, but we want to say that one of the ways you can serve your community is to be aware of your own risks and get all of the advice and access vaccines or immunizations if you're eligible, but also be aware of other people's risks. That if you've got a cold for you could be a severe pneumonia for an older person. A cold for you could be an episode of bronchiolitis for a young baby. And none of us want to do that to our fellow community family members. So it's really about that shared responsibility that we're trying to emphasize today, as well as these particular new tools for RSV, which you should all be thinking is one of the big three: influenza, COVID, RSV.
Influenza, COVID, RSV. I remember that. And also, it is important to, like you said, as I said, we're not trying to discourage people from going. We're just making sure that that shared message of what could be something simple for me could be really worse for someone else.
Looking after each other, it's very important.
We've got 2 minutes to go. We have all those links on the chat, and I think that the fantastic information on the new medicine that's available for younger babies and children is really great. But Dr. Jeremy, is there any other parting words you'd like to say to the community, to the multicultural media, and to the health workers online?
Oh, look, thanks for getting the message out. It's really important that we make sure we are engaging with the community to highlight the importance of keeping each other safe through those simple things like getting vaccinated if you're eligible, making sure that you're trusting your instincts in terms of, if you're a parent, seeing the doctor early if you're worried about your child, and generally keeping each other safe. It's very important.
Well, thank you for joining us, Dr. Jeremy. And Dr. Phil, any parting words?
Happy Easter, everybody.
Happy Easter to you, and for those celebrating Ramadan also, and all the other celebrations. Keep safe, and thank you for joining us. We have all the links on the chat, and we'll be sending out the recording, and they are also available on the Multicultural Health Communication Service website, and will be shared on the New South Wales Health and MHCS social media platforms and in YouTube. Thank you for joining us. We'll be back again in another fortnight with more information on health, public health, and remember those new medicine that's available for the community. And on that note, remember the big threes: influenza, COVID, and RSV. Dr. Phil, am I right? Thank you very much, everyone. We'll see you again next time.